All right, go.
This is pediatric intubation. So make sure I have all my supplies ready. Backup airways, suction, oxygen. So first we're gonna pre-oxygenate the patient. We'll use an OPA. We're gonna measure it from the corner of the mouth to the tip of the earlobe. We're gonna get an appropriately sized on. And then make sure we push the tongue down. We can have a tongue depressor to help us with this. And we're gonna pre-oxygenate the patient to as close to 100 SpO2 as possible. Once we get as high as we can, we're gonna ventilate there for about 3 minutes. Once we've pre-oxygenated the patient, we're gonna begin the intubation attempt. I'm gonna have someone watching the monitor to watch the SpO2 level. When it goes below a certain percent, we'll say under 90, we're gonna immediately stop the intubation and pre-oxygenate again. I took my tube out of its sterile wrapper. I'm gonna hold on to it for this attempt. I'm gonna position the child's airway, making sure not to tilt the head too far back and close off the airway. And then as I'm going down with the blade, I'm gonna identify my landmarks. Since I'm using a Miller blade, I'll lift the epiglottis. And once I visualize the vocal cords, I'll insert the tube. And then I'm going to confirm placement with misting of the tube, capnography, numerical and waveform, and listen to lung sounds and listen for the absence of epigastric sounds.